Hi everyone, Scott Nicholson with the Judy Nicholson Kidney Cancer Foundation, and today we have another live speaker series for you. Today we've brought in a chaplain with a lot of experience in helping cancer patients and survivors cope with the stress of that type of situation, and we'd love to answer any questions that you have in regards to that. So her name is Liz Mayforth. She's been a chaplain for 30 years, and she's here to answer your questions today. So let me turn the camera around. Hi, Liz.
Good morning, Scott.
So tell us a little bit about your work in Pennsylvania.
Okay, I am a hospice chaplain, which involves, if you will, assessing spiritual needs of patients and their caregivers, and to assess if they're comfortable, if they're in spiritual distress, if they're in need of sacramental ministry, if they're what to meet their needs.
That's awesome. What is hospice exactly for people who may not be familiar with that?
Hospice is if you will, a movement for those with life-limiting diagnosis. And that can be anywhere from days, hours, to months, to actually years. We've had people on hospice for 30 months, for example, but people are reevaluated every 90 days to see if they're still eligible based on their symptom management for hospice care. And hospice care involves obviously wonderful nursing staff, aides, social workers, the chaplain, as well as a physician who oversees the patient's well-being.
And we're starting to get some people to join here. What different levels of care are there?
When you hear the word hospice, hospice is just a intentional, if you will, very intentional level of care that is given to patients and their families. And some places, people will choose inpatient, actually a hospice, if you will, hospice house for their remaining days. We offer hospice in nursing homes as well as in hospitals if that's the family's wishes to keep their loved one in a hospital. The hospice will come in, but primarily our work is for patients and caregivers in the home. So you do have those, if you will, 4 levels of care that hospice does provide.
Who serves as members of the hospice team?
As I said, we have a social worker, the chaplain, we have nurses, as well as the physician who oversees the patient's medical records and their care, and the aides are unsung heroes who visit patients on a regular basis to offer just simple tasks such as bathing. Aides will vacuum, aides will prepare meals, aides will do whatever is needed to bring comfort and hope, if you will, to this family.
Lauren is asking, are there different levels of care?
Absolutely. I mean, different levels. For example, there are hospices that provide continuous care based on symptom management. And that's very, very important to find a hospice that will offer what they call continuous care for symptom management up to, let's say, 5 days, with the family agreeing to allow someone, let's say an LPN, to be at the bedside 24/7. And that is, if you will, continuous care, and rather than having the family deal with, if you will, at the time of death, when symptom management, the patient's body is shutting down.
Is a chaplain typically part of a particular denomination?
No, absolutely not. Okay. Chaplains, we do have credentials, which are very, very important. I'm a Lutheran pastor, and I have had training, if you will, and a lot of clinical pastoral education. So in order to be a chaplain, which is identified as a minister ministering to all faiths. So we have rabbis, we have priests, we have Protestant ministers. So they, if you will, we have to be accredited to serve as a chaplain. And a chaplain, as I said, is either a minister, a priest, or a rabbi, and even an imam that has the right credentials.
Will there be bereavement care for families?
Absolutely.
And
Normally,
what's the time frame
hospice
for that?
organizations will follow a family for 13 months. And that may involve support groups. They'll receive mailings as far as suggesting that what you're experiencing in your grief is normal. And we do have support groups. We'll have luncheons. We'll have an opportunity to find months. And sometimes to make the referral to say that, maybe a support group would be really, really helpful to you in your grief, that you're not alone. And so often families do feel alone.
Who provides the medical equipment and the supplies that are necessary for that type of care?
The hospice does it, no cost to the family. Hospice will provide the hospital bed, sometimes the commode, any kind of the tables, something as simple as wipes, gloves, all the oxygen.
At no cost?
At no cost, because that is part of if you're in Medicare, Medicaid, or private insurance. So it's beneficial to, obviously, our health organizations to utilize hospice rather than hospitals.
I see. Gotcha. So do Medicare and Medicaid, they don't have anything to do with it? There's no financial...
Right.
Is there any part that they pay on
there
that?
should be no financial burden to the family to include medication. All that is covered under the hospice umbrella, if you will.
Okay.
So equipment, medication, it's a package deal. So whether at no cost to the family, and that's very, very important that that is covered.
Is hospice care available 24 hours a day, 7 days a week?
Normally, depending on the organization, but yes. In lieu of calling, for example, 911, you call us.
I see.
So we've had phone calls from a lift assist, as far as somebody has fallen, what should we do? So we really stress the importance of calling the number that you're given on your refrigerator. Call hospice before you call anyone else, and then we will send a nurse out to assess. So often families will panic and want to take the patient to the hospital, and that won't change the patient's diagnosis by any means, but we're offering comfort when there are no medical options available.
What are there any other benefits besides comfort? Comfort's certainly a big part of it, but are there any other benefits for patients or family members if they choose hospice care?
I think one of the greatest benefits is the support hospice offers. And hospice really means quality of life, and how do we make the most of the time that we have. So, we encourage patients, if you will, to get their hair done or to go out to that outing. So it's not something that... hospice is the best kept secret when you have a life-limiting illness. And that's not to say that you're giving up, and that's not to say that it's coming to terms with the end of life.
And so that was actually Lauren's next question was, isn't hospice for people who have given up? But that is not the case.
No, it's trying to make the most of the time, the moments in a family and patient's life. And if they can have, reconciliation is huge. Sometimes it is the long goodbye for families, in the sense of they're ready, they've made amends, they've made peace with their loved one, and sometimes the body has to catch up with the spirit.
Do they need to have an advance directive to be on hospice?
Not necessarily. It's helpful, for example, what we call an out-of-hospital DNR. And that says that if the time comes and you do call EMS or that you don't want aggressive treatment, you don't want people to be breaking your ribs in order doing CPR, for example. So making those 5 wishes we provide for the family. What do you want? We don't require it. We don't require a DNR, but we offer that.
Can a patient keep their primary physician?
Absolutely. We offer that, as well as I said, the medical director. Some physicians are inclined, if you will, to say, I'm done, because there's no, if you will, treatment for this patient. There's nothing else I can do. But if you have an attending physician who's willing to walk with you in this journey, absolutely, they can keep their primary physician.
How long do patients typically spend in hospice care?
Everyone is unique, and that's the big thing. I mean, so often people have a preconceived notion of hospice as if you will, Kevokian, that comes in and administers some sort of drug and the patient dies. That's not the case with hospice. We have folks, again, who enter hospice with hours to live, days, weeks, months, years, and it's based on symptom management.
What do you do in case of an emergency?
Again, you call if you're not in inpatient hospice and you're at home, you call the hospice organization and they will send a nurse out 24/7. So we have on call. And just like, for example, if someone is having a difficult time during the passing, they'll call me to go to the family as well.
I see. And what happens if you are seeking aggressive treatments? What is an aggressive treatment?
An aggressive treatment is with perhaps a new miracle drug may arise, or if someone is seeking aggressive treatment saying, I want physical therapy, or I want occupational therapy, or I want the chemo or radiation. That is considered aggressive treatment. Okay. So it's when no longer, aggressive treatment is that there are options available for you, and then you cannot be on hospice as well as those options.
Someone's asking if you could share a story of I'm sure over the past 30 years there's a few stories that you have. Is there a story that you could share with us?
I'd be happy to. One of, if you will, we're not supposed to have favorite patients, but I do. And his name was Frank. And Frank had COPD. And Frank lived by himself in an apartment. And he, if you will, was our model patient. That Frank welcomed chaplain visits on a weekly basis. And I was able to not only minister to Frank, who was of the Roman Catholic tradition, but we became friends. That, I would call and say, hey, I'm passing McDonald's. Do you need anything, Frank? And I would encourage him, for example, to take advantage of activities in his apartment building, get out of his room. So patients become very, very close to the hospice staff. So depending on their needs, I don't want to say we're jack of all trades, but you have nurses with different talents, and when a patient does pass, we grieve too. And that's the part of the team mentality, that we take care of one another. Patients and families come first, but we do take care of one another as staff.
Some people watching this video, this may be the first time that they have heard about hospice as even being an option to them. Where can they go to find out more about hospice? is there, I mean, you're in Pennsylvania, so you may not want to get calls from people all over the country. So where can people reach out?
Just Google.
Okay.
Google hospice care. And the first hospice originated in England. And then based on the quality of life that these patients experienced, it came to the United States. And it's interesting, I've been to the hospice facility in Branford, Connecticut, which is one of the first. And there are no dead ends in this building. It's all circular, as if life is a journey.
Hmm. Well, I want to thank you so much for coming out here and answering our questions today. I'm sure I linked to your Facebook page. Is it all right if people message you if they have any questions?
Absolutely.
Okay.
I welcome any questions and whatever we can do to support patients and their families, because again, I think it is just there's nothing to be afraid of. And if we're talking about quality of life and improving that.
And there's no doubt that it has helped people within our foundation, and certainly you've seen the benefits firsthand. So again, thank you very much, Liz.
Thanks, Scott.
You have a great day.
Thank you.